Welcome back. And in case you're just joining us, you're in time for the conversations that we had lined up for you on the show this morning. Later on, Ayub Abdikadir will be taking you through a very important conversation that will help you become a better person. Remember, it's the International Coaching Week that runs from, it started on 8th and will go all the way till the 14th. And in studio this morning, he will be engaging former CS Cecily Kariuki, an executive leadership coach, to just shed light on the significance of what is going on in our country and globally as well. But before that, we will be talking about the International Nurses Day this morning. It's coming up on Friday, and we chose on Daybreak this morning to just put the spotlight on nurses to understand the pivotal role that they play in the health sector and what needs to be done even as we look at the future of nursing, because that is actually one of the things that have been pegged on the theme of this year's celebrations. And in studio this morning, I have a panel of two, a lady and a gentleman, and sitting on the center there, we have Dr. Edna Talam. She is the CEO, Nursing Council of Kenya. Thank you for creating time this morning. We have Mr. Collins Ajwang. Collins is the president of the National Nurses Association of Kenya. Asante for coming this morning. Thank you. We are celebrating nurses this coming Friday, something we should do every day anyway, considering the weight of the responsibility that nurses have. But I want to understand from the both of you, as we edge closer to Friday, what are some of the expectations? And perhaps for somebody who is hearing this for the very first time and wants to know the significance of why we are doing this, why we are marking this international celebration, what would you say? Let me start with you, Dr.
Thanks so much, Safina. And when we talk about the nurses, I think what comes to our mind is that every time I step to an health facility or an OL, who is this nurse? So the celebration of the nurses is what it has been marked every year, every 12th of May, and we are celebrating both nurses and midwives. The International Midwives Week we celebrated last week on Friday. But this basically just to ensure that we acknowledge the role of the nurses. We keep at pace, as per the International Council for Nurses, a theme every year for us to be able to just understand what is the crucial role of the nurses. Every time we have a theme, this year our theme is Our Nurses, Our Future, and for the midwives is that we are working from the evidence-based practice, making sure that the midwives that we train are competent and are able to work is. Within this week, we are advocating on the roles, having conversation in regards of collaborations on the advocacy for why nurses should be put in the front, and also investment in the healthcare, because within that space, and we saw, as Safina, even during COVID-19 pandemic, on the crucial role that the nurses are doing. Those celebrations goes beyond having even us as nurses and midwives going to the community and offering our services to our clients, having conversations within our own multidisciplinary group, the stakeholders, and at the same time, again, the nurses are within the heart of our community, celebrating for their roles that they play, for the 24 hours that they work within the entire day of their lives. That's 24
hours, I can imagine. Collins, for you, first as a nurse and as a representative of an umbrella body of nurses, what are your expectations and why is this week important for you as a group?
Yes, thank you, Safin, for hosting us and for recognizing the nurses and midwives of Kenya and inviting us to your show this morning. Nursing has come a long way. From the rudimentary nursing that we had, provided by the pioneer of nursing, Florence Nightingale, during the Crimean War of 1854, when the British and the French were fighting the Russians in Ukraine. So the war went on, and there were a lot of casualties involving the soldiers. And when word reached Britain that there were so many casualties that were unattended, and so many infections were setting into the army, the British government recognized nursing as the key element that could help avert the mortalities. So they sent the Florence Nightingale with a team of 38 nurses to the Crimean War. And their intervention, including hygiene and a healthy lifestyle for the soldiers, helped to prevent a substantial amount of deaths. And this one was an innovation and an evolution of the nursing profession. Then coming to the modern nursing, we are celebrating Florence Nightingale birthday that is coming up on every 12th of May in recognition of her contribution to the nursing profession. Kenya, we are not unique. We are joining the global nursing fraternity in celebrating Florence Nightingale for her service to humanity. And we are bringing, we are also having CSR activities across the country. And as an association, National Nurse Association of Kenya, with its 47 branches and 74 countrywide, we are reaching out to our communities. We are reaching out to our individuals. We are reaching out to everyone, so that we bring up the face of nursing, the human face of nursing, and we showcase what we do as nurses countrywide alongside our global colleagues.
The reason we are doing this, let me just take you back a bit, and you will help me explain in depth why it's important. We have different facets of what makes I would say a comprehensive or a good healthcare system. It comprises of a strong governance, appropriate financing, a stable supply chain of what is needed, access to health facilities if people can access. But one thing that probably also needs to be looked at in depth is the workforce, the health workforce. And Daktari, I want you to shed more light on this. Why should perhaps as a country, why should we refocus our thinking and even our decision making and even our in terms of budgeting? Why is it important that as we look at the health sector in its entirety, in the 360 perspective, why is it important to pay close attention to the health workforce, the human resource in health? And if you look at the context of our country, Kenya, as we mark this very important day, do we have any reason to celebrate in terms of the progress we've made in investment in that particular section of the health sector?
Thanks, Safina. If we see the current theme for the nurses, we are talking about our nurses and we are talking about our future. So even just before I come to the issue of the workforce, even as we see what is the future, our future is where we need to be able to address the global health challenges. And when I said about global health challenges, in COVID-19 pandemic, we actually realized that it was a global challenge which affects us as a country. And at the same time, again, we've also learned on the issues of the pandemic. And it's that time that we realized that our healthcare systems has to be strengthened, one including the human resources, and that is the workforce that we are talking about, leaving alone the working condition, the infrastructure, the supplies, and all those components that you should be able to support the delivery of healthcare. At the same time, nurses, among other healthcare professionals, are the ones to shape the future of the healthcare. And when I say nurses, it's because of the numbers that we have. 80% of the care that we offer to our women, our children, offered by nurses and midwives to our communities, is primarily offered by the nurses. If you see the primary healthcare systems where the nurses work, and that is tier 1 in the community, tier 2 in the dispensary, all the way to even our national referral hospital is where the nurses are coming from. At the same time, again, is how do we also ensure that even as we talk about the workforce and we also focus in particular on the crucial role the nurses and midwives are playing, is that we really drive the innovations. in our healthcare systems. We influence the policy decisions. And at the same time, we lead the multidisciplinary team. If you see if a patient, let's just take a patient are pregnant. I love talking about women and children, perhaps because I'm a woman. But just talking about women and children, and even as the mother even starts, having the pregnancy, we actually have the midwives taking, all through the entire continuum of care until the delivery and all that. And even in the human perspective, as we are born, we see the nurses and midwives there. And even as we end our life, we also still see the same. So that is the crucial point where the nurses are in the central within the healthcare system. Now, going back to the issues of the workforce, and we are not able to do much if we do not try to think about the workforce planning and even going to the future. And we talk about workforce is having the correct skills mix, ensuring that we have appropriate trained healthcare workforce, including the nurses, the midwives, the doctors, the clinicians, the nutritionists. We have over 13 cadres that they are regulated within this space that we should be able to think about that. That is first the quality of the educations. How competent are they to be able to do that? And that is the investment we need to be able to talk to. As we have the entry levels of the training, how much investments are we making for the specializations? And even after that, once they've been able to specialize, what investments are we making to ensure that we retain them within our workforce? We ensure that their working conditions are good, how that our inputs in regards of the resources that we provide translates to the processes, efficiency, effectiveness of our management systems, and at the same time we get the desired outcomes. So in regards of investment and regards of ensuring that we provide that, it's actually in regards of ensuring that whatever we produce is good for the public, and it's actually meet our goals and also surpass within the region and internationally. We need to ensure that we retain them. We also need to ensure that, again, equal pay as per equal service. They provide for us the service, we ensure that they are paid. But once more, beyond even that is also how is the working environment. The study which was actually, the survey which was done amongst the midwives by the White Ribbon Alliance, it basically indicated, actually the first priority for the midwives did not say that it was the pay. They say that we want our mothers to have beds to deliver. We want to ensure blood is there. We want to ensure gloves are there. We want to ensure that basic running water is there. We want to ensure that when the baby is delivered, there is another midwives. So if a woman is delivering, we should be able to have a minimum of 2 midwives. One to take care of the mother, one to take care of the baby.
So the concern was not about how much they earn, despite the work.
Yes.
It was more about their working environment.
Exactly. Fair enough. Yes, fair enough, Safina. It's basically, in regards to priority, of course the pay came in, but one was almost is that ensure our working environment are good, including safety. How do we ensure that even as our nurses and midwives go to work at an environment where they are respected, they are protected, and they are also safe? Yes.
All right. But, Dr. has described what I would say, I don't know whether it's the reality on the ground.
Yes.
Yeah, and this is where I want you to come in, Collins. Yes. She has talked about what it takes to train and ensure that these nurses and midwives have what it takes. She has also described what is sort of like an ideal working environment for them. Ideally, what they should be paid for the long hours that they put in what they do in a day-to-day basis. But is that the case? Take me through a regular day in the life of a nurse or a midwife in Kenya specifically.
Yes, a regular day in the life of a nurse or a midwife is very tiresome and very involving. First, we have to recognize that at least in your life, you will meet a nurse. You have met a nurse when you go to any service delivery point, whether it is at level 1, 2, or 3, the only person you will meet there will be a nurse. And maybe that's the only person you'll meet in your entire life. And the nurses perform very essential functions in healthcare delivery system, where we provide almost 90% of healthcare services. And most patients come to the hospital because of nursing care. So a day of a nurse, if I take you through maybe shortly, you go to a health facility. The first person you meet will be a nurse. You go to maybe a department like MCH or a dispensary level 1 or level 2, you meet a nurse taking you through antenatal clinic, doing your basic vital signs, doing your basic investigations and assessment, and also take your history, and has makes a profile for you to know the client better. So all these things can take time. From the time you go to just assess one patient, from the time the client enters antenatal mother comes to your clinic until the mother exits, take like around 20 minutes per case. And this, if you have like 20 mothers coming to your facility, it takes like almost 8 hours or 10 hours if you work non-stop. Mm-hmm. But you find that in level 1, level 2 or 3, it is only one nurse working in a facility. This one will make sure that the nurse will stay in that department for nearly 8 hours. Mm-hmm. But it's not just one department that's working. Most facilities in level 2 and 3 are manned by one nurse. So you find that other clinics are also running. There's a maternity services running. There's we also do promotions. We do health talks. We also do treatment that's going on. You find that the nurses are also the ones doing the dispensing and everything. So the day of a nurse is always packed. And as we provide these services, the only challenge that we are having in our healthcare system is the nurses needs to be motivated.
Yeah, and as we go there, you know, as we look at the day that we are celebrating what nurses and midwives, you know, are doing in this season. Was it last week when there was that week for midwives?
Yes.
Yeah, yes. And we are going into the day that we're celebrating nurses. Mm-hmm. What are some of the issues that you would say are posing a challenge in the work of this, you know, crucial sector of the healthcare professionals, the nurses and the midwives? If you look at how they work, the hours that they put in there, the work environment, especially in the context of Kenya, not in the international standards, just Kenya, what is it that is creating a challenge in how they deliver their work?
The challenges that nurses face in their work stations include a lack of motivation. You go to a health facility, you find that the nurse was last promoted like 7 years ago, 9 years ago. There's no promotions for nurses. They stagnated in one job group for so long. And this one is affecting their pay and their morale at work. The next is redesignation. Even the education system for the nurses has been expanded, and there's a very clear career pathway for education, for nurses to achieve their high standard of education. But upon attaining the next level of education, even redesignation from one cadre to the next is not even easy. And this does not even cost much. But redesignation is another problem that nurses are facing in our workstations. The other challenge that nurses are having is lack of prioritization in remuneration. You find most counties, there's delay of salary payments, which is having a negative impact on the nurses, because they are also having families to take care of, children to pay school fees, rent to be paid, and the tenants, the landlords will not take it that the county has not paid you. Most nurses have been bundled out of their houses because of late or delayed salary payments. So when salary is delayed for 3 months and the loans also catch up with you, it basically affects then your pay. Even if you have a 3 months delay or 2 months delay in remittance of salary, the bank will take whatever is in the account. So even if 1 month is paid, another arrears of 2 months remaining, you will still don't have salaries for the next several months. Another challenge you are having are shortages. There is acute shortage of health workers. And the shortages has accrued because of natural attrition. The nurses are dying. Some of them are also, there's also no employment at the country level. And most countries have resorted to employing on contracts, which are not easily being picked up by health workers, especially nurses, because they have low pay and they are not of value to the nurses. And also there is also the shortage is also created by immigration of nurses to greener pastures abroad. So this has occasioned shortages across the counties, and when there's a shortage, there'll always be a gap in management, and we ask the government to make sure that there's enough staffing of nurses personnel so that we can achieve quality nursing care to our patients. Another issue that nurses are having are issues of there's delay in provision of the scheme of service. Nurses, the last scheme of service that was done was several years ago, around 10 years ago. That scheme of service is obsolete now. There's the process that the scheme of, that there's already complete developed scheme of service for nurses, but the government has not yet approved it for implementation. We urge the government to, as a matter of urgency, to consider releasing the scheme of service for nurses.
All right. Collins has talked about quite a number of challenges, and I know if I gave him an opportunity, he could go on and on. Seems like there's a lot going on in that sector. But one thing that stood out for me, though, he sort of like he confirmed something I came across when I was prepping for the show. Just looking at, you know, the nurse to patient ratio, the recommended vis-a-vis what we have in our country. You know, he's talked about shortage, and in 2013 there was a report dubbed A Universal Truth, No Health Without a Workforce, that was done by the World Health Organization, which established that 44.6% of the 186 countries with available data did not meet the minimum threshold of 22.8 skilled health professionals, which include midwives, nurses, and doctors, per 10,000 population that is recommended by, you know, the World Health Report. I mean, Kenya is one of the countries in the 44.6% that has not met that recommended, you know, threshold of the ratio, the nurse vis-a-vis patient ratio. I want you to talk a bit about that and why we have that situation, because people are pursuing nursing, and I looked at some piece of article which was saying the lack of employment and the shortage is sort of like are going in tandem. We are saying we have shortage, yet we have quite a number who have not been employed. Probably take me through the realities, what is happening and why this seems to be a problem.
Yes. Safin, I think that is, you know, a very great conversations to pick it up. Indeed, you are right. At the moment, Kenya, we still fall short of the recommended ratios. We are at 13 nurses, midwives, doctors, healthcare workforce as per 10,000 population, which means we are sort of half. So we still need to be able to put more than 50% effort to ensure that we get the recommended ratios. My colleague Collins spoke about the challenges that we face. And I luckily said in regards of that shortages and all that thing is because of the disparities we have. So first, we have disparities in regards of where are we providing the care, at what level. We have the level 2, which is the dispensary, all the way to level 6, which is our National Referral Hospital. Examples is Kenyatta National Hospital and Moi Teaching and Referral Hospital. In addition to that, we also have the disparities between rural and the urban. And you actually see that from the statistics, because of the pull factors that it attracts the healthcare workforce, including nurses and midwives, to work in level 4, level 5 of our facilities, and level 6. Level 4 is our county hospitals, county referral hospital, and level 6 is our national referral hospitals. That is where now we basically have a bit of disparity. So in regards of the distributions and planning and management of the workforce, there's a lot of disparities. disparities. We can go in a facility, as you show, which was being shown a few weeks ago, in regards of having one nurse within Kajiado Hospital. And this is also goes in regards of the role diversifications, where it is one nurse who is able to pick up the roles that ordinarily could have been shared by the other professional because of the skills mix. You know, we should have a lab technician, someone in the pharmacy. Bare minimum, we should even have a watchman, to be able to ensure even the safety of the public and that. So coming to where we are and also highlighting is because of historical issues which has been there. We have not been able to recruit and retain as much as we have the attrition. So you realize that the attrition rates are high. We have aging populations, as earlier mentioned, our colleagues who are there in the workforce who are retiring. And again, the complexity came in when we devolved the services to the counties. And within the counties, again, major disparities. We have counties that they've done great job to invest in recruitment and retention of their health workforce. We have counties where the attrition is also very high and we're not able to do that. Indeed, we are able to have good production. In a year, we are able to produce between 9,000 to 10,000 nurses. And when I say nurses and midwives, it goes from the certificate level. We have the diploma, we have the degree, we have higher diploma who have specialized postgraduate diploma, masters, all the way to PhD, and even at the moment we have advanced nurse practitioner and advanced midwife practitioners. Being
but if you're saying our production is that impressive, then why are we not having them working for us?
Safina,
why don't we see them in our health facilities?
So it goes back to economic situations where we are. Let us go back to how much money that we are supposed to be able to dedicate to the healthcare. And when we say that this is the budget that we have for the health, beyond the salaries and remunerations and employing them, there's the other factors. There is the infrastructure development, the capex, budget that it goes to the setting up, hospitals, buying the equipments and all that. So more focus as we go to the future is that as we build our institutions, let us just know that this decision will be completed in the next 1 year. We'll have equipment raised, but who will be able to manage the equipments? Who will be able to offer the services? So the issue here is that we have not been able to employ as much as the attrition, even as much as we have expanded. Indeed, we have expanded. And that is really great to actually ensure that we...
So it's a good problem we are having? Is that what you're saying?
I am just saying it is in two prongs. In regards of the infrastructure, we've expanded. At least when we go to Mashinani, we are able to see dispensaries, we are able to see the health centers, but we've not planned on who is managing. Yes. So indeed, we have the infrastructure, but we've not been able to plan. So we need to ensure that we have the appropriate skills mix. So if we are setting, let me give an example of a dispensary. When we are setting a dispensary, we should be able to forecast and just plan that in the next 2 years, I should be able to have 10 nurses, 3 clinical officers, 1 medical doctor, 3 lab, and that. So we do not do that. But even as much as we also do that, how much budget is being provided? So it's really a balance that we just need to be able to make. So that is where now we are having challenges. But moving to the future is to ensure that how do we even ensure that on our planning, if we are supposed to recruit 60% of the workforce, are we able to have a plan where we are able to achieve the little milestones? Let us even employ 15%, let us employ 20%, let us employ 30%, so that it is a progressive. And within our 5-year plan, we should have met at least the minimum purpose we are. We may not be able to basically achieve the 100% workforce. We may not achieve the 22 per 10,000. But can we be able even to achieve 18? Yes.
Let's improve.
Yes.
Let's do something.
Let us do something. Let us improve.
Collins, you talked about something that I want you to shed more light on. That one of the challenges that you cited there was the fact that our workforce goes abroad for greener pastures. Talk to me about that and how disastrous it is for us as a country. As we look at the future of nursing, why should we begin to rethink and keep our nurses within our borders? Because that seems to be one of the problems you mentioned earlier.
Thank you, Safin. Nurses in Kenya have borne the burden of ineffective health system. They have suffered, there have been, some of course have died, some have been disabled, and basically the system does not support nurses as much in this situation. There are so many nurses who have been who have had disabilities, but none has been compensated.
In line of work?
In line of work, none has been compensated. Some of them have contracted several other conditions that they didn't have at their place of work. None has been compensated. I know there's a policy of compensation, but there is the reporting and implementation has been a challenge. So these things have demoralized nurses. Another issue is disparities, like Dr. is saying, disparities in employment. Counties are not employing with the right scheme. That's why we are basically, as a matter of urgency, we require that scheme to be out, to be implemented by the government. So the counties are not employing as per the scheme of service.
When you say scheme of service, yeah. Just talk to me about what as nurses you would want as the ideal, procedure or strategy to use. What's captured in this new, scheme of service that you feel would work in terms of recruitment?
The scheme of service that we have already developed has a very clear guideline on entry level and the corresponding remuneration. And it has recognized the expanded scope of nurses as it is, and also it has recognized in the previous scheme it did not recognize some competencies like higher diploma, APN, masters and the rest. But in the new scheme it has all the others, everyone in the scheme. So it has got entry employment as per the entry job in every entry job group. Now, that scheme, if it is in the shelves, the counties do not have it. So they are not using it. Now, every county now employs at their own will because there is no policy, there is no guideline on how to employ this nurse at this job group. And so when they miss out, they are just employing at random, and then they don't recognize that this nurse needs to be with this qualification, needs to be employed at this group and with this remuneration. So that's a challenge that is demotivating to the nurses. The other one is the lack of investment in nursing, especially in healthcare. You go to your workstation and you find several things are missing. You don't have the adequate supplies to perform the procedures that you want, also to provide services. This and then salary delays and the rest. So these ones have made nurses to look for employment in other areas, and especially that's the major reason why nurses go abroad, because the government is not seriously investing in its health workforce. So if the government could just at least recognize the health workers and give them the necessary remuneration as per required, and motivate them to work, then even mitigating on this migration is easier. But with these lapses, most nurses will prefer working abroad where systems work. So when this has also created a large chunk of nurses who are going abroad. But what we are asking the government also is, it is good to go and work abroad, but let's have good policies that support this migration. Like when you don't, at a point you will go abroad, and then from there you want to come back home. So the issue is, when you go abroad, you are going for service delivery. Then you are currently you have to terminate your services with the employer. We are advocating because we are Kenyans. We would like to go abroad, and still, if you don't find it comfortable there, we should be allowed to come back here and continue practicing. At the same time, your benefits. At the time you are going abroad, your benefits should be nurses should be given their benefits. Not that when you go abroad, your benefits are terminated, and it's like you have never worked for that system, and they don't recognize you. So these are the areas where we need a friendly policy for the nurses to encourage immigration and also to support the communities that are being left here in Kenya.
The reason I'm concerned about this, and Dr. you'll weigh in on this, is because Africa, and specifically sub-Saharan Africa, is one of the areas that bears the hugest disease burden. In fact, the weight of the global disease burden, you know, we carry a big chunk of it as Africa. That's why it's important for us to rethink how we look at our health system. How much do we invest? Do we have the right people? Do they have the right skills, the right equipment to use to be able to serve the health needs that we have as a continent? In your conversations, you know, I know the institution you represent really looks at the standards that must be met, the threshold for one to be a nurse. Do you flip the coin to look at how much they get also in terms of reward for what they put in terms of training and in terms of the long hours that they work? As we celebrate nurses, what is the status of the conversations that are going on around addressing some of the challenges that Collins here has spoken on behalf of the hundreds and thousands of nurses out there?
Okay. Thanks. You know, the conversations of immigrations being within the Africa region, Kenya, of course, we are the Africa, and you know we love our Africa that we want, is sustaining or mitigating the immigration or migration issues within our fragile health systems is maybe a little bit complex and challenging. But we acknowledge the fact of where are we coming in as a country, and even as nurses and the professions. Yes, indeed, there's a lot of challenges and issues basically surrounding the issues of the retention, issues of the migrations and all that thing. But I think the conversation there in regards of us as Nursing Council of Kenya, who we are mandated, and you put it rightly, to be able to uphold the standards of midwifery and nursing educational practice, and to ensure that the standards are met. And when I said about the standards, is even that what is the minimum standards that the nursing care should be provided, which I had alluded earlier that if a woman is giving birth, bare minimum, we need 2 midwives, and moving forward on that. But conversion has been done because we are part of the development of strategies and also policies that they favor the nurses, and among us other healthcare provisions. So first is to have a conversations, and this conversation we've been able to do, even what Collins mentions, that we have been in the forefront to develop career progression guidelines, which we used to call them scheme of service. He has referred to that. And when we talk about that, we just said, when we have the certificate nurse all the way to the masters, to the PhDs, which we already have. I, as Edna, of course, I am a nurse and a midwife. But how do we just ensure that the scope of practice, what they are limited to be able to do, is translated to their job descriptions, to their competencies, and that again is attached to a salary and also a pay and the roles. So that is what we have been advocating to be able to invest in that. Again, is improving working conditions. Bare minimum is that we've been able to develop the standards of practice. You know, during COVID, we reviewed what should a critical care units be, how many nurses, how many doctors, how many clinicians should be part of that conversations, and even to ensure that we have our nurses who have specialized at higher levels, from higher diploma to the masters, and that be part of healthcare system. Unfortunately, Safina, we've not been able to employ, especially our masters, even our bachelors, within that. We are still far from ensuring that if we have 20 nurses, we have 3 with diplomas, we have 10 with bachelors, and we have 20 above that. Again, is also issues of professional development opportunities. The good thing, Safina, is that we have been able to make progress in nursing and midwifery, and we've ensured that we have programs that it will be able to support nurses to still continue working, especially tapping on the ICT infrastructure, where we have our e-learning platforms within our institutions, and they are able to balance the work that the nurses are able to do. If, for example, you are family, you have a job, you are able to go to schools and move there. But again, the issue which we are having conversation, and even as we talk this morning, we just want to urge all the employers in our institutions to provide learning institutions. And when I say learning institution, is that we have dedicated and protected time for the nurses and midwives to be able to go to school, to be able to learn, because those are part of the push and pull factors that Collins alluded earlier, that these are the things that it pushes our nurses to go to immigrate. They are able to balance their work, their families, and their educations. Again, is to provide incentives for the nurses to ensure that we facilitate the transfer of knowledge. When someone goes to school and comes back with a certificate, whether it is a year, whether it's 2 years, it should be able to be remunerated first, to be placed in where they're supposed to be placed. And we've always advocated as Nursing Council of Kenya, if we go to a facility where we have a critical care nurse placed perhaps in an orthopedic department, we always actually advocate to the institution and tell them, please make sure that you deploy this nurse to where that they can be able to utilize their potential, because we really need to unleash the potential of the nurses. We need to ensure that whatever they are trained, they are able to work on. But what is a little bit constant is that ensuring that we have good investment, especially in finances, to be put within both the national and county government for them to be employed, for them to be retained, for them to be promoted.
All right. I know we'll be getting feedback shortly.
I wanted to add to what Dr. Edna is saying is the other challenge that is there with as at now is lack of directorate of nursing. Nursing, we are the majority of health workforce in Kenya. So there's the leader of majority is not being recognized at the health within the health system.
I love the analogy.
No. Now, you see, if you don't recognize the leader of majority and you want to implement UHC, it becomes a challenge.
Yeah.
I know the Ministry of Health currently is very focused on delivering on the UHC and the standard of health in Kenya. I know they have the goodwill, but they have done something. But previously we have the Directorate of Nursing, but it was watered down to a unit. Right now I know that we have talked to the ministry and they have already given it a division. What we want is a directorate. So the Director of Nursing, if you are the Director of Nursing, then it cascades down to the counties. This will be a big motivator to the nurses. Another issue where nurses feel left out is on trainings and scholarships. The government has this system of training and scholarship. You have to develop your system. Building an effective health system, the quality of nursing care you get depends on the training opportunities you accord to the nurses. The nurses have the capacity to perform, but what the government should do is to support them and provide training opportunities and scholarship for the nurses. And the last one is the issue of the new one that came up just a few weeks ago, the issue of taxation. Our pay slips are full, and they want to increase the housing levy fund, NHIF.
The payslip is full with money, or what?
No, it is already. It is already on a third rule. It is already emaciated and malnourished. But if you apply these three, tax on our per diem, tax on the NHIF, tax on housing levy, where are they going to get the money in our payslips? We don't have that money. And if it is implemented, we are going to have negative balances. Now, are we going to work for free for the government? So nurses, we are opposed to this taxation. In fact, we are rendering essential health services, and we should be tax exempted because we provide services. Some of us work 24 hours. So we are this one. I wish the ministry should listen to the nurses because of these services that we are offering, and to the counties. Why build more health health facilities, and you don't employ the health workers. So some of them run on one nurse, which is still not able to provide even those quality services as required.
All right. Yes. Proposing there that you should be exempted from tax. Of course, I just want to celebrate one nurse that was recently recognized for a Global Nursing Award. Yeah. And after this, I'll be asking you what keeps you going. Her name is Christine Mawia Sami. She's from the Kitui County Referral Hospital. She has 27 years of experience, and of course she was recognized for her role in neonatal nursing, helping newborns to helping in improving the survival rates of newborns. She established the first ever newborn unit in Kitui County in 2010, and this is how she did it. She transformed a single nursery room into an independent newborn unit at the hospital, and by so doing, the neonatal mortality dropped drastically from above 50% to below 10% within a span of just 1 year. And I can go on and on about what earned her this global recognition, but we have so many Christines out there who we celebrate today. Just recently, our very own Gatete Njoroge did a very good story about a nurse who was doing everything from being the driver of their own version of an ambulance to being the security guard. She's the lab tech. She's everything in that particular health facility. Yes, of course, there you have it. We have Christine Mawia Sami. That is the nurse that we celebrate this morning. She established the first ever newborn unit in Kitui County in 2010. Neonatal mortality then dropped from above 50% to below 10 within just 1 year. And of course, there we see the problem that asphyxia was the main problem in Kitui, and of course this was leading to deaths of several young children there, and she managed to change the narrative. She coordinated the newborn resuscitation mentorship. She was awarded by former First Lady Margaret Kenyatta for Nurse-Led Initiative of the Year 2021. In 2022, she was honored by President of Kenya as a trailblazer in reproductive health. Of course, a lot that has gone on into what she has been able to achieve, and now globally she's known as one of the people that have given the nursing profession its integrity and the much needed attention that it requires, and many more out there. It's not just Christine Mawia Sami, even that nurse at your local health facility who burns the midnight oil just to make sure that all of you are safe. We celebrate each and every one of them. And we're just about to wrap up, but I want to now shift gears a little bit. We've talked about the negative and the challenges in this profession, but do we have a reason to celebrate? Let me start with you, Collins. What keeps you going? There has to be something, you know? Yes. Despite the challenges, you're still strong and you keep going. What is it that keeps you going?
Me, personally, I love nursing, and I'm proud to be a nurse because of several reasons. One of them is we are celebrating Christine Mawia for her good work in Kitui. I want to tell you, it is not by coincidence that she is coming from Kitui. We just launched the Nurses Week. Nurses Midwives Week in Kitui, and the governor, Dr. Julius Malombe, is a good man. He has really improved on the health systems in Kitui, and I know Christine is not alone in that department. So there's a team of nurses who have helped Christine to achieve the reduction of these neonatal mortality rates in Kitui and to manage the asphyxias. So kudos to Kitui team. But there are so many nurses in the country that has really performed well, Christine being just the best, but so many across our 47 counties. I want to say my co-panelist, Dr. Edna Talam, is looking at getting a global award in the ICN conference in July. We have nominated her as one of the best nurses in Kenya. She's competing with the rest of the world for the Joe Moore In Award. that will be done when the nurses will be congregating for the International Council of Nurses in Montreal, Canada in July. So she's our best candidate.
We are yet to go there.
Yes, and also we have our other nurses. We have Dr. Winja, who is also coming up for Florence Nightingale Innovations. I think it is Innovations Award, following her dedicated service at the Ministry of Health. We have got also several nurses who are in leadership positions. And we have the CEOs of different hospitals, Kenyatta University Teaching and Referral Hospital, who is a nurse, Dr. Dagani, and several other CEOs. Dr. Edna Talamia is the CEO of Nursing Council, and she has really done a good work at the council, from a paper council to now a digital council, and we appreciate her so much. And we also have others, CEOs, like Kemet CEO. We also have the a nurse CEO at in other health facilities. We also have MPs who are nurses.
Okay.
Yes, and also PSS who are nurses. And I'm proud of nursing because it has opened the education system, the career pathway. We started as certificate nurses. By then, it was nursing was it was reaching the diploma level. Right now, our career pathway has been opened to PhD, and this was a great thing for nurses. On jobs, we have got nurses who have specialized in different areas within the health system. Some of them are having masters and practicing advanced practice, and some are doing advanced practice nursing, and these are really motivated several nurses to take up nursing.
All right.
And I know most of us would like our children to be nurses as well.
Indeed.
Yes.
Of course. That's a good thing to hear. You know, after you spoke about all those challenges, I was a bit concerned. But maybe in future, we may not have nurses in our hospitals, but that's really encouraging.
Yes.
Daktari, just also to shed light on the success stories and the reason we are celebrating. Do you have any reason to celebrate? Do nurses have any reason to celebrate?
Yes, indeed, we have the reason to celebrate. You realize that as nurses, we have demonstrated resilience. We are being able to demonstrate that we are able to adapt, the adaptability that we are able to have, and again, the dedication in the difficult situations. When I say dedication in difficult situations, is that every time there's a crisis, the first person in response is a nurse and a midwife. Whether it is an emergency unit, whether it's in the call center, most of our facilities at night, the nurses are the ones who are coordinating all services, including even our National Referral Hospital. So the reasons why we have is because we have been able to demonstrate that we are a dedicated cadre, professional cadre, that we are able to have resilience within our health systems. And even beyond that, of course, we've spoke about the challenges we have. But again, we also see the light of the day. How many Kenyans, as we talk now, are having a smile in their face because our nurse has injected them a painkiller? You know,
you smiling because of an injection.
Yes. So when we see the smile and we even get satisfaction, even as we are working, administer all these challenges. And I remember even myself is working within the clinical, and that when I deliver a woman, when I see the baby, when I see that baby crying, when I wheel my patients to theater and come when a fracture has been fixed, we are happy.
Gives you satisfaction.
It gives us satisfactions.
Wow.
And that is the reasons why even our role extends beyond the care. It extends to ensure that we provide emotional support, which it is our satisfactions and a smile to do. We provide,
funny thing, and it's a good thing that you're there in almost every stage of life.
Absolutely.
You're there when a baby is breathing their first, and you're there when somebody is breathing their last.
And that is, and I think our dominance in the health system as really should be appreciated instead of being feared, because the fear of the dominance has made it to the extent that some cadres maybe feel threatened, because you find that nurses or institutions led by nurses have done very well, because they know what nurses need. and they provide what nurses want. And those facilities have done excellent jobs. But in systems where nurses have been curtailed, that they don't even have, they cannot even make decisions to purchase emergency drugs, they don't have the authority to do this, those policies have really watered down the efforts of nurses in those.
In your words, the leader of majority should prioritize.
Yes.
Absolutely.
And I just want now to look at what you have been saying on social media. We invited your feedback at Citizen TV Kenya on Twitter, and we want to hear what you have to say. Bob Otieno Owino, since the promulgation of the 2010 Constitution, which devolved the health docket from the national to county government, this has affected doctors' work, which has led to poor services because counties have failed financially, talking about doctors, but nurses as well. Nurses, that is Engineer Lazaro, you say nurses are always in the front line fighting dangerous pandemics around the globe. For example, Ebola, COVID, HIV, cancer, and malaria. Nurses should be given same privileges currently being enjoyed by the Department of Defense. All right, Engineer Lazaro. Honorable Lilian Sioi, the government's neglect of nurses issue is appalling and must end immediately. It's time to prioritize the health sector and support these hardworking doctors, not just with lip service. There is nothing to be celebrated either. Hey, people are talking about doctors. Okay, Sir _Nixon, you say there has been cases of nurses impoliteness leading to impediment of patients' rights in selected Kenyan hospitals, where at times patients die in the eyes of rude and ignorant nurses. Shall this ever end? All right. We have Ray _Ghetto. I doubt if county government recognize the advanced nurse practitioners, APNs, if their ignorance of graduate nurses, BSN, perpetuates. Let's have a national body that will recruit nurses fairly on behalf of the counties. One of the issues that we discussed earlier. At Samuel Worth, you say the KEMSA scandal made it clear that Kenya must make immediate investments in its healthcare system in order to increase access to high quality care for all. And we have at Godi Barasa, where as a country we should rethink our strategy about healthcare system. The government should create incentives that will attract nurses to work locally and seal off any possible human capital flight. Right, Kipngeno, head boy. Most of the interns in our maternity wings in hospitals don't have requisite experience in pregnancy, hence risking our mothers by giving wrong diagnosis. If possible, let's have them in other faculties, but in maternity, let them not go beyond the registry. Odongo Rolex, you say we can celebrate our nurses as more as we can, but the problem we have as Kenyans is high rate of unemployment. So many people professionally qualified, not only in health sector, but also in other areas, but not employed. Something must be done. Thank you for that. Honorable Lilian Sioi, you say being a nurse is a honorable job and an opportunity to serve humanity. Our health system should invest more resources in the training of nurses so as to improve their effectiveness in delivering health services. Thank you, Honorable Lilian Sioi, for your feedback. And that's just a bit of what you have shared with us this morning at Citizen TV Kenya, at Safina _Chengatayo Abdikadir. And we want to just wrap it up on that point. I'll give you a chance to give me your final words on this. There's been a concern, though, from Sir Nixon, who says the rudeness and the ignorance of some nurses in a section of hospitals in the country is quite concerning. People, they've seen interesting memes of nurses. Is this even true? And is it lack of motivation or what? That sometimes you'd find a nurse who is really stern and sometimes you don't get a friendly experience.
I think you'll start with me.
Yes.
All right. I think I've worked in several busy facilities, and I must appreciate that most of the patients or relatives that come to our facilities do not know who they are talking to. Some of them do not know they are talking to patient attendant, they are talking to a security personnel, they are talking to a casual worker. everyone they see as a nurse. But nurses, we have our ethical standards of how we are dealing with our patients. Most of the time, what we need is, we need more time with patients. But we take information from the relatives or caretakers and to manage these patients. So our hospitals what we can lack is time. We can lack time to address the relatives, which in Moja hospitals are done by a licensed person, as nurses are left to do the technical work managing these patients. So, and this has worked very well in most facilities. But coming to that discussion, I don't think nurses has time to stand and be rude to a patient or a relative or a caretaker, and also the long hours also bring strain, fatigue and sometimes somebody can also get psychosocially.
So you agree to some extent?
To some extent, it
okay.
can, but not always. Thank you.
All right, we've run out of time, but I'll give you just 30 seconds for your final words as well, Dr.
All right, just to wrap it up, that all our clients, our patients, deserve positive patients' experiences. And being rude or that is unacceptable. And we are making strides to ensure that we have communications for our nurses and midwives and everyone in the healthcare systems to be able to have good communication skills to our clients, irrespective of the circumstances we have, and ensure that we have all our clients to be able to have patients' experiences. As we wrap it up, and as I had mentioned earlier, and also still saying that we have demonstrated all this resilience, adaptability, and dedication to the service. And I think what we are just calling for action is that let us invest for our nurses and midwives, let us invest in cruise strategies to ensure that we retain and we do that. And of course, to you, Safin, and your colleagues, let us ensure that we have visibility of the nurses. Let our public know where we are, even as we support our current manifesto of ensuring that universal healthcare delivery within bottom-up approach and, of course, primary healthcare, the people that they will be able to ensure that we deliver within the primary healthcare space are our nurses and the midwives, because they are the ones who encounter with the communities, they encounter with the families, and from there we should be able to see improvement in the quality of service.
Thank you. Thank you so much. Let the leader of majority lead. That's what I would say. As we mark the International Nurses Day this coming Friday, our nurses, our future. What are we doing as we gear into the future of nurses in terms of their welfare, their working conditions, what they need to be able to give us quality healthcare services? Those are some of the pertinent questions that we should be answering. And I just want to wrap it up there, paving way for Ayub Abdikadir, who will be taking this a notch higher. He will be engaging former Cabinet Secretary Cecily Kariuki, who is today wearing a different hat as an executive leadership coach. Of course, there's something interesting happening at the country right now, began on the 8th to go all the way till the 14th of this particular month, the International Coaching Week, and that they'll be discussing more with regards to this pivotal event that is happening, I believe, globally in just a bit. Do stay with us. This is Daybreak. My name is Safin Acheng Auma. Thank you.